So we just wrapped up a great conference with Congresswoman Donna Shalala, Congressman Larry Buckshon, and two panels of expert guests. What were the key takeaways at this event for you?
Well, it was an interesting conversation all morning. There's always good and important things to talk about in terms of healthcare, obviously immediate concerns about the coronavirus. But one of the things that came across this morning was the fact that there were a lot of questions and just issues about how can you get things done in Washington? How can you find common ground on healthcare? It seems like we're sometimes talking at cross purposes. And on behalf of Better Medicare Alliance, which actually sponsored this conference, I was glad to see that there was some conversation about the fact that Medicare Advantage is a place where Democrats and Republicans have reached a place where they both support it. We saw 403 members of Congress, 75% of Congress, sign a letter in support of Medicare Advantage just a couple of months ago in advance of our annual rate notice is what they did. But that was a pretty remarkable moment when you think about how partisan things have gotten in politics these days. And that's sometimes because, well, for Medicare Advantage, Republicans like the fact that it's a public-private partnership, that there's competition in the private sector, a little more nimbleness to be innovative and respond to really needs of individuals and do things differently if they need to, or keep innovating. And Democrats really appreciate the guarantees and the security and the additional benefits that can be offered to help address social determinants of health, for example. And both R's and D's like lower costs for consumers and lower costs for the government. So we're proud to see bipartisan support for Medicare Advantage.